Bellows breath. Bhastrika Pranyama. Bhastrika means bellows in Sanskrit, and it describes the dynamic filling and emptying of the lungs, like a blacksmith who uses a bellows to stroke a fire. Bhastrika is similar to Kapalabhati, except there is a forced inhalation as well as a forced exhalation. Imagine how pumping a bellows forces air in and out. This practice is traditionally used to ignite our inner anji, digestive fire, and boost energy levels. Raising our blood pH level increases appetite and, when followed by retention, aids in detoxification and elimination. Bhastrika creates a lot of rajas energy, and similar to rajas, this powerful practice can quickly exhaust itself, so we must be aware of how we use and manage the practice. Energetically, Bhastrika is focused around the third chakra at the navel, which represents self-esteem, willpower, and purpose. Most of these qualities center on having a positive view of ourself, which fosters healthy social engagement with others. When we have an imbalance or dysfunction in this area, we become introverted, insecure, and antisocial. Usually, these feelings of repression are a sign of a chronically overstimulated dorsal vagal complex, which is responsible for the freeze response. Bhastrika is a powerful tool to suppress the dorsal vagal tone and help mobilize us by balancing the nervous system, or to increase our energy when we are in a low or balanced state. To practice Bhastrika, we start in the same sitting posture as we would with Kalabhati, so that we can easily expand and contract the belly. With Bhastrika, we move approximately 1,000 to 1,500 milliliters of air per breath, depending on the force of our respirations, or 2 to 3 times as much as we would normally. Each breath is exaggerated and is controlled by the abdominal muscles and diaphragm. On the inhalation, push your belly outward as you partially fill the lungs. The breath is deeper than a normal breath, but not as deep as a full inhalation. On the exhalation, pull your belly in towards the spine and hollow out the stomach, similar to the forced exhalation in the Kapalabhati technique. The inhalation and exhalation should be audible as the air rushes in and out of your nostrils. The inhalation and exhalation should match in length and intensity and should be as smooth as possible while keeping the pumping action of the stomach. The speed of this breath will vary depending on our focus or intention. Breathing slower usually results in a deeper breath and more attention around the contractions of the core. Faster breathing expels more carbon dioxide, but also takes more practice and coordination to keep the breath smooth and consistent. The typical range for Bhastraki is 1 to 2 breaths per second. Bhastrika Pranayama requires the most effort of these 3 rapid breathing exercises and is the hardest to maintain. With this breath, we quickly stimulate the sympathetic nervous system to increase our energy levels, boost metabolism, increase appetite, and get moving. The contractions of the core strengthen and tone the belly, and the rapid forced inhalations strengthen the diaphragm. The movement of the stomach stimulates the abdominal organs. However, the activation of the sympathetic nervous system quickly suppresses gastric mobility and increases colonic tone. Traditionally, this practice is followed by breath retention. When we hold the breath after stimulating the abdominal organs with Bhastrika, the breath retention allows CO2 to build back up to suppress the sympathetic nervous system and activate the parasympathetic nervous system, which boosts digestion and lowers colonic tone for elimination. One of the advantages of Bhastrika, and one of the main reasons I employ this rapid breathing practice, is to quickly expel a large amount of carbon dioxide and create a carbon dioxide deficient environment. As discussed with Kalabhalati, the more hypocapnic we are, the longer we can hold our breath before having the urge to breathe. Because carbon dioxide levels take a while to build back up when we are holding our breath, we use more of the oxygen in our blood, and this lowers our SpO2 levels. Less oxygen in the blood creates more of a demand for the red blood cells and stimulates their production, similar to the effects of high-altitude training. Note, because of the forceful abdominal contractions, you should not do this practice if you are pregnant or have gastrointestinal problems.